All right. Hello, everyone. I am here with Dr. Sue. Dr. Sue is a board-certified pediatrician with 2 decades of experience helping thousands of families achieve healthy lifestyles. She specializes in diet and lifestyle, but also helps with conditions such as autism. Thanks for coming on, Dr. Sue.
Absolutely, Alex. Happy to help.
So, how long have you been working on autism research, and what percentage of your work does that take up?
So I've been working with children with autism for probably 2 decades, since about 2002, so pretty close to 20 years. And I don't do research, I'm a clinician, so I work with them in the office,
Okay.
helping them achieve health naturally through diet and nutrition.
Okay. So, what are some of the most common symptoms of this condition?
I think what I usually see at the very young age is difficulty with verbal communication is probably the most common one, and socially, having problems socially, either with eye contact is a big one for little ones. Really having eye contact one-on-one. Those are probably the two most common ones that I see.
Okay. So, I was diagnosed in 2003, and during that time, the diagnosis rate was around 1 in 150 children, and today it has risen to around 1 in 60. Why
Wow.
has the diagnosis rate increased so dramatically, and is it projected to continue growing, do you think?
Well, I don't think we have the exact answer to that. I think definitely increase awareness. I know one thing is that we cannot blame genetics, because genetics doesn't happen that quickly. Changes in our genetics don't happen that quickly.
Hmm.
And so all disease is a combination of your genetics interacting with your environment. So that leads us back to our environment, of what's happening in our environment to increase the risk of autism, right? And so your environment includes how you eat, how you rest, how you move, all the toxicities that are in our world, and how your genetics are interacting with those toxicities in the world. So I think a lot of the research moving forward is really looking at how our genes are interacting with our environment, and what type of environmental insults are interacting with genetics to create that dis-ease pattern we label as autism.
Okay. All right, so I was diagnosed at age 3, which is a very young age, especially for this condition. In regards to positive social health, are there more advantages than disadvantages to being diagnosed at a young age, or is it vice versa?
I always encourage a diagnosis as early as possible, just because of interventions that can help, right? So I
Hmm.
think the earlier the diagnosis, the better. I think it can be very hard to diagnose at a younger age, and that's why, but I do think that we're getting better with increased awareness at becoming aware of these children who are kind of fall into the autism spectrum.
Okay,
So I'm a big fan of early diagnosis for early intervention.
for sure. And do you think like having the child know early on that they have this condition, do you think that helps better with their social life? Or do you think that causes more setbacks, honestly?
I think it's very helpful. I've had other moms explain to their children that their brain works differently, and I think that I really see the value in all of our brains and how they all work differently. And I
Right.
learn a lot through children with autism. And I don't think that my brain is better than their brain. I think that our brains work differently, and that we each bring unique gifts to the world. So my goal is really not is my goal is really to help them achieve the best life that they can live, so they can put their gifts forward to the world. And that's what we all want to do. We all want to be in this world to serve each other, right? We're in this
Right.
together. So I really see it as we work differently. So I would, personally, if I had a child with autism, that's how I would explain it to them, that all our brains work differently, and your brain works differently than my brain. That's true for all of us, honestly. But I've seen mothers do that with their children. And I think it's a really empowering way to teach kids about their condition labeled as autism,
Hmm.
that enables them to, move forward with and learn how to harness the best of their, brain working differently.
That's awesome. Yeah, like finding the strengths in that is really beneficial. So Asperger's and autism, they're very wide spectrums.
Mm-hmm.
How does someone medically diagnose someone? Because it seems to me like it's more beneficial for self-diagnosis
Mm-hmm.
instead of medical diagnosis. So I'm just wondering, like, how does that process work for medically diagnosing someone?
Typically, they go to developmental specialists now who do series of testing. And so it's done through observation and also answering of questionnaires is really
Hmm.
how it's done. It's not like you can take a blood test or do an x-ray, right? It's all really more observation of behavior by a specialist who's seen, the patterns of autism. Does that make sense?
Yeah, definitely. So could it be detected through an MRI since it's a neural condition or neurological
They
condition?
they do see differences in patterns of children on MRIs, but it's not like you can diagnose it. Like you can't just say, "I want a diagnosis of autism here. Go take your MRI and check that checks the box."
Okay, that makes sense. So it's pretty clear to me that like we know so much more about autism than we did 18 years ago. Would you say a condition like this is constantly improving in research and knowledge?
I believe that to be true.
Okay. Yeah. So what's the biggest and most important question that has yet to be answered about this condition?
I think going back to the etiology, like what meaning, like why does it even happen? What are all the differentiating genetic variations? So our genetics, it's all disease is really a combination of our genetics and our environment. So really the research always has to go back to like what are the genetic similarities of children with autism, right?
Hmm.
And then what are the environmental insults that are triggering those genes to turn on and off? So that's that's where I think that we could really help because our genes aren't fixed. Like we know from the field of epigenetics that they're adaptable based on the input that we give them. So, for example, a big thing that I do with kids with autism, a lot of them have something called methylation genetics. And methylation genetics you can get to turn on and off by giving certain nutrients like methylated B vitamin, right? So
Okay, yeah.
it can be something that's really easy to override, right? But you have to be able to look for it, like look for that pattern. So
Right.
that's an example of, one way that you can do that.
So I'm wondering if there's any sort of medication because like for ADHD, for example, like they notice the patterns, they notice those genes, and then they get them on a treatment, and that often includes medication. Um,
Hmm.
is there something like that for autism?
Really, it's more of a mixed bag. So usually children with autism have other struggles, like a lot of them, have attention and focus issues, or they have anxiety, or they have depression, or they
Hmm.
have other things that kind of fit into medical diagnoses that we treat with medication. So they'll often get on medication for those reasons.
Okay. And there's been a lot of debate about like a cure for autism. Do you
Hmm.
think like based on the formation, I don't know if formation is the right word, but like do you think that will be possible in the near future?
I think for all disease, it's really about coming back to the fundamental, like what are the genetic setups, like so what are our genetic risk factors, what are the patterns that we carry in our genes,
Hmm.
and then how do we adapt our diet and lifestyle to get those genes to work for us if we can. So there's definitely some genetics where we can't seem to halt the progression of the disease, but there's definitely disease where we can halt the progression based on our diet and lifestyle.
Okay. I mean, But the problem is though, like autism is not a disease. Like you don't get like sick from autism. It's like a condition that like goes through your whole life. Um, are there any cures for conditions or no?
Yeah, I mean, I've definitely seen kids who lose their label of autism. So if you
Okay.
want to consider that a cure, I mean, I've seen that in my 2 decades of practice.
Does I remember when I was a freshman, we wanted to try out HBOT therapy. Um,
Hmm.
what kind of improvement does that help with autism?
I actually don't have experience with that, so I don't know.
Okay. My final question. During Autism Awareness Month, like there's a lot of there tends to be a lot of donations and like support for further research in this condition. Have you noticed like any breakthroughs during that month, or do donations not really help with this kind of stuff?
Well, I think money matters. So donations always help, right? Money matters because that's what allows us, researchers to do the work that they need. But I personally, because I'm not so tied to the research end of it, I'm more on the clinical side. I haven't
Mhm.
seen any trends related to that during Autism Awareness Month. But I think in general, all awareness months are great because it brings awareness, right? It brings
Right.
people to realize, you know, again, like we forget those stats, like that stat that you told me in the beginning, one in how many now?
It's about 1 in 60.
Yeah, 1 in 60, right? And I often rely back on the stat of like 1 in 125, I think is when I initially learned the stat, right? So
Right.
awareness is all just like you keep bringing that back to the table, like 1 in 60, that's really high, right? So I think that is all very helpful.
Yeah. Alrighty. Well, I don't have any more questions. Is there anything that you'd like to add about this condition? And it's
No, just thank you for doing what you're doing and bringing awareness to everyone. It's really important. And it's great to see that you're researching and learning and helping others understand it.
absolutely, and that's the thing. Like, I have to meet people halfway on this because, like, really, ignorance about this condition is really no excuse in today's world. So like, people need
Hmm.
to do their research, but at the same time, I need to like bring them information that they really wouldn't know from people without this condition.
Hmm. And meeting people where they're at, right? Like I always try to meet people where they're at.
Exactly, yeah. Alrighty, well, thank you, Dr. Sue, for coming
Hmm.
on. I really appreciate this.
Absolutely. Bye, Alex.